Knock, knock. Hi, my name's Michelle. I'm going to be your EPCC student nurse, and I'm going to be performing a head-to-toe assessment. Is that okay with you?
Yes.
Okay, great. I'm going to go ahead and do hand hygiene, and then put the hand sanitizer on, and then I'm going to go ahead and check your wristband. If I can have your first and last name, please.
Corey Hernandez.
Okay, great. And your date of birth?
2/26/89.
Okay, thank you. And that matches medical record. That's fine. You can go ahead and put your arm down. Do you know what today is?
Yes. Today is Wednesday, the 29th of April.
Okay.
2020.
Sorry. And who the president is?
Donald Trump.
Okay, great. So then I'll document that the patient is alert and oriented ×4. He was able to give me his first and last name, date of birth, who the president is, and what we're going to be doing today. I'm going to go ahead and get started. I'm going to start with the head examination. So for this, I'm going to put on some gloves, hand hygiene, put on the gloves. And first, I'm just going to go ahead and inspect your head. Okay. I'm going to be feeling around and let me know if you feel any tenderness. Okay. And I'm feeling for any lumps, for any tenderness. Do you feel any pain or tenderness while I'm feeling around your head?
No.
Okay, great. And then next I'm going to go ahead and examine his hair. There is no, also like the scalp, there is no lesions, there is no infestations. You do have a scar right here. What does that do to?
When I was little, I fell on the ground.
Okay. Here. So that was due to a fall. I'm going to check this side. And the scalp, the color of his scalp looks fine. It looks the same as the color of his skin, his face. There is no inflammation that I see. The hair is growing evenly on all sides. It's fine, a little thin. There is slightly thinning on this top area, but not too bad. And then next I'm going to go ahead and come over here. I'm going to go ahead and take off my gloves since I finished and dispose of those. And then what I'm going to go ahead and do now is I'm going to go ahead and check his face. If you could go ahead and close your eyes real tight and then open them back up. Great. And then if you can smile. And then puff out your cheeks. And then frown. Great. And then if you could stick out your tongue and move it from side to side. Okay, great. Okay, so those cranial nerves are intact. And then if you can go ahead and bite down. Okay, and I do feel the little ball. It's normal. I don't feel any swelling. If you can go ahead and try opening up your mouth, leave your head straight. And try opening up your mouth against my resistance. Okay. And that was good. And then gonna go ahead and check his mouth inside. His lips are nice and pink. There is no signs of any lesions or any sores. There's no dryness or cracks. And you can go ahead and stick out your tongue, and then you're gonna go ah. And I do see the uvula rise up. And then if you could go ahead and go like this, so I can see the bottom of your tongue. Okay, good job. There's no lesions, there's no sores, nothing. And what I could see, his gums and his teeth are intact and they're nice. Gums are pink. I'm gonna go ahead and check for your teeth, any caries. Okay, there is one fill that he has on the bottom right side. Let's see. Then I'm gonna go ahead and check your nose. Okay, I'm gonna push down right here on the maxilla and tell me if you feel any pressure or any pain.
No, no pain.
Okay, and any pressure or any pain right here on the frontal sinuses?
No.
Okay, great. And then let's see here. I'm checking his eyebrows, and they're even in growth on hair. His eyelids are not swollen. There's no edema. The sclera, can you open up your eyes just a little bit? The sclera is white. It's nice. And right here, it's nice and pink. The conjunctiva is nice and pink. His pupils or his eyes are round. They're equal. And then we're going to check the perla for pupils equally round, reacted to light, and accommodation. So we're going to do several tests for that. If I can have you focus on this cross over there at the corner of the wall. Okay, and then I'm going to come in with the light, and I'm going to go ahead and see his pupils contract. Okay, now go ahead and do the same. Focus over there, and I'm going to step over here just a little bit. And then I'm going to also bring in the light. And they did constrict. Both pupils constricted to a 4. And then, are you okay? Yeah, okay. And then if you can go ahead and focus on the same object again. And then I'm going to go ahead and put this object and focus on this one now. Okay, so you were able to accommodate. Now, without moving your head or anything, you're just going to follow my pin. And his eyes did go ahead and accommodate. They did cross. And then now what we're going to do is the 6 fields of gaze. I'm going to put my pen right here, and you're just going to follow it. Don't move your head or anything. You're just going to follow with your eyes. Ready? Perfect. Okay, and he did not have nystagmus. They did not shake or anything. Let's see here. Since we're still on the top part, I'm going to test his another cranial nerve by doing the whisper test. Okay. And I'm going to go ahead and cover this ear.
Now open that up.
Yes. And then I'm going to say something else, and you're going to repeat it back to me.
Okay.
Yes. And then, so that cranial nerve is intact. Now I'm going to go ahead and check his ears. And I'm checking to see the helix of his ears, the back of his ears, that there's no edema. There is a little redness. Is that normal for you to have a little bit of redness on the top?
Yes.
Okay. He does have a mole right here, but they are equal and symmetrical. They are equal and symmetrical, and there is no drainage. If I had an otoscope, I would be able to look inside the ear with the otoscope and see that the tympanic membrane, and the tympanic membrane would be like a pearly grayish color. Again, there is no edema, any swelling, any drainage, any lesions, or any tenderness. On the nose, coming back to the nose part, I'm going to go ahead and look inside your nose. And then I'm gonna see there is no drainage, there is no patency. If you can go ahead and breathe in and out, and then do the same with the other side. And I can hear the airflow. Do you have any trouble breathing? No? I did notice that the left side of the nares is a little thinner from the right side. It does look like there is like a septum deviation just a little to the left. Does this bony prominence of the nose hurt?
No.
Okay. Alrighty. And then I forgot to mention that he does have a little bit of a mustache and a little bit of a goatee on the bottom. So you would want to check for any infestations or lice. And I'll be coming back to do that right before I go to the feet when I put my gloves back on. And then what I'm going to do next is I'm going to go ahead and check his throat. I'm going to check for any swellingness. I'm going to check the lymph nodes. I'm checking the lymph nodes now. Tell me if you feel any tenderness at any point. Okay, and then behind the ear, on the occipital, and I don't feel any masses or any nodules or any swellingness. And then right here, where the thyroid is, can you swallow? Okay. And was that with ease? That was with ease. He was able to swallow. There's no inflammation. There's no bulging out of the thyroid. Now, if you can just barely turn your head back just a little and then turn to the side, I'm checking for any jugular distension. There is no distension. You can go ahead and put your head back like that. And I'm looking for the color of the face. It's warm, it's not hot, it's nice and pink in color. He is light complected. There's several moles on the face, on the head, on the scalp, the ears. Then what I would do is I would inspect his chest area. And in the chest area, I would make sure that there's no lesions or open wounds or any lumps, masses, or anything like that. I'm going to go ahead and just feel, and you let me know if you have any tenderness. Do you feel any tenderness? No. Okay. And so if you can just stand, or actually that's fine, you don't have to stand. I'm looking at his chest, and there is no barreling of the chest like when you see with COPD patients. His chest and the backside is nice and straight. The chest part is equal, and then the back, there is no signs of any kyphosis, of any lordosis, or scoliosis. So that's good. And then if you can shrug your shoulders, again for resistance, good job. And then if you can go like this, great. And I'm looking at the muscles too. The muscles are symmetrical, you're fine. And I'm looking at the skin color for any lesions, for any edema, for any swelling. There is no swelling. If you can go like this, if you can open and close your hands. This is for the range of motion and the joints in the hands and all. Do you do that with ease, or do you have any pain?
So these.
Okay, great. There is a little bit of redness, dryness. Is this recent?
It's recent because I'm washing my hands constantly.
Okay, right. Yeah, with everything that's going on, we do tend to get dry hands. So now what I'm checking is still the color. It's good. And I'm going to check capillary refill. Less than 2 seconds. And I'm doing the same for the other. less than 2 seconds. So capillary refill is good. And then I'm gonna check for pulse. So I'm gonna check his carotid. And that's regular 2 plus. Regular 2 plus. You'll never want to check the carotid artery together bilaterally. Then we're going to go ahead and check the brachial artery, the brachial pulse. And that's a regular 2 plus. Checking radial pulse, and that was a regular 2 plus. I'm going to go ahead and listen to heart sound and lung sounds. Okay. So for the lung sounds, I'm going to be listening first with my diaphragm, and I'm going to start with the apex. Everywhere I put my stethoscope, you're going to take a deep breath in and out. Okay, so we're going to go ahead and start here. Okay. And then we're going to do the second intercostal space. On both sides. Breathe that in. Okay. Again. And then again. And then there's 2 more. I'm going to get the sides. And then 1 more deep breath in, out. Okay, good job. And then if you can scoot just a little bit forward. And I'm going to hear the lungs in the back, through his back. And I'm checking for any lesions, for any lumps. I'm palpating. Do you feel any tenderness?
No.
And you can also wait to do this once you are inspecting all the back. But we'll go ahead and just take care of it now. And there's no tenderness here. Okay.
No.
Alrighty. So I am gonna listen. If you can, just so that the camera can see, I'm gonna have you turn. I'm gonna have you turn around so that I can have the camera see. I'm gonna go ahead and actually, I'm gonna turn the whole chair. That way your back is facing. Okay, there we go. No, if you can face the wall that way, that way. Thank you. So right here, that way you can see where I'm auscultating. I'm gonna go ahead and start up at the apex. If you could take a deep breath and out. Over here as well. Then I'm gonna go down. Here's the 7th C7. And then we're gonna go down to about T3. And not on the scapula and not on the spinal cord, but right here in between is where I'm going to start auscultating. And I'm going to go from left to right, all the way down from T3 to T10 to hear both sides of the lungs. The 3 lobes on the right and the 2 on the left. Let's go ahead and start. If you can go ahead and take a deep breath. And out. Over here. And out. Breathe in. Out. Breathe in. Out. And then over here. Over here. I'm going to do it right here. Out. And then breathe in. Out. And then we're going to get 2 more right here on the sides. One more over here. Okay, great. Then I'm also going to check with this side and see if I don't hear any abnormal breath sounds, adventitious breath sounds. And just breathe normally. You would keep on coming down all the way to T10. And then if you can turn to face the camera again, please. Now I'm going to check for any abnormal breathing sounds in the front with the bell. Go ahead. Okay. You can breathe normally. Just in and out. In. And right here on the sides. And one more. And all 5 lobes are clear. No abnormal breath sounds. I'm going to go ahead and have you lay down now. I'm just going to check the camera to make sure that we can see right here. So, I'm going to check his skin turgor. And you just pinch and make sure that the skin goes back, and it did. It went back with ease, it didn't stay up, so there's no edema. And then in the front, I'm gonna auscultate for his heart, and then I'm gonna check his abdominal area. So first the heart and all 5 points. So on the right side, after you get to the angle of Louis, you go to the right. On the second intercostal space, you're gonna hear the aortic. Lub dub, lub dub. And then you're gonna move to the other side, the left side, second intercostal space, pulmonic. Lub dub, lub dub. And then the third intercostal space, that's the Erb's point. I also hear lub dub, lub dub. And then the fourth intercostal space, that is the tricuspid. And then for the fifth intercostal space, you're gonna go from the midclavicular, so like right here, down to the fifth intercostal space. And it's gonna be right below, right here. And that's the mitral. That's the apical. I'm gonna go ahead and take the apical pulse right now for a full minute. That was 68, and that's normal. I'm gonna check for any bruit with the bell. So I'm gonna check those same spaces, the 5 spaces, the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral, for any bruit, for any swishing sounds. So angle Louis, second intercostal. Pulmonic, second intercostal on the left side. Third intercostal, Erb's point. Fourth intercostal, tricuspid. And then the fifth, midclavicular to the fifth intercostal. And I don't feel any bruit. I don't hear any. And when we palpated, there was no masses. There was no tenderness. Okay. Like I said, the arms are in color, good in color. I looked at the abdominal area. The abdominal does not have any distension. It doesn't have any lesions. But if your patient did have any ostomy care, you would want to check it at that time. any chest tube on the side, and of course also when you're checking for the arms and everything like that, you would want to check the IV catheter to make sure that it's intact and that there's no swelling, there's no infiltration, there's no edema, there's nothing like that. And also you're checking for bony prominences, like in the back, the scapula, the back of the head, depending on how they sit or lay, and for how long. The elbows, remember, there is no skin breakdown in the elbows. That's a bony prominence. Now this time I'm gonna go ahead and listen for bowel sounds. When's the last bowel that you had?
This morning.
This morning? Okay. I'm gonna start with the right lower quadrant. And I hear some active bowel sounds. I'm gonna go to the right upper quadrant. Also active. Left upper quadrant. Oh yeah, must be hungry. And then the left lower quadrant. And I do hear those bowel sounds. Let's see here. I'm gonna go ahead and check the aortic, the abdominal aortic, for any bruit. And that you find in the xiphoid process, at the very end of the xiphoid process of the sternum. You go down just a little bit before you get to the navel, before you get to the belly button. And with your bell, you're going to hear for any bruit. Then you would check the right lower area, the left, and then the iliac, which is below the umbilical, above the suprapubis, that we're not going to be checking for. On both sides. It's all clear. Everything is good. Right now I'm going to go ahead and do my palpation. And we did the palpations last on the abdominal area so that we can avoid activating those bowel sounds. So I'm going to go ahead and start with the right lower quadrant, and I'm going to feel for any masses, any nodules, any hardness inside your stomach. Let me know if you feel any pain or any tenderness. I'm going to go ahead and start. I'm going to start here on the left lower quadrant, on the right upper quadrant. I don't feel any masses. It feels nice, soft. The left lower upper quadrant,